8, 7, 6.
Building a better Bay Area. Moving forward, finding solutions. This is ABC7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, we'll look at a new report card that looks at the well-being of children in California, where we shined and where we failed, plus how to address all of it. But first, the CDC is about to announce new mask guidelines, or at least an update to reflect the Omicron reality. This comes as the White House promises more test kits to keep schools open, and one Bay Area county going to bring back bans on large gatherings and recommends sheltering at home when possible. Joining us now to discuss these issues and answer your questions, feel free to ask them on Facebook Live, infectious disease specialist Dr. Monica Gandhi of UCSF. Dr. Gandhi, thanks a lot for joining us.
Thank you.
Let's start big picture. The Omicron surge right now, record case numbers again in California today. Any signs that we are peaking?
Yes, there are signs that we are peaking. Actually, New York was ahead of us. It's already peaked. Boston is starting to go down. They look at their wastewater, which we don't hear, and our cases are starting to peak, and it's called a Nessie curve, but it's starting to come down. So thank goodness, hopefully not much longer. It's been really painful.
So how long do you think before this wave is over?
So the models, at least in California, had shown peaking by mid-January. We're exactly getting there. Then it comes down pretty fast. If we look at South Africa and the UK, then it still is going to take a while to come down. Let's think of mid-February as life being much better.
Mid-February. Okay. But let's talk about the here and now. The California Department of Public Health graph today showing hospitalizations and ICU numbers in San Francisco during this wave compared to the previous waves, and they do look very different. Walk us through this.
Yes. So, what has happened is we have so much immunity here in San Francisco. As you know, we have great vaccination rates, been amazing. And so there's this, what's called decoupling. That's how we call it. And we have a lot of cases, but our hospitalizations, especially for COVID, as opposed to just when you swab the nose. I'm actually working in the hospital right now. We swab everyone who comes in. And we have, at least Gene Noble did an analysis that about at least 2/3 are kind of there, at least at UCSF, incidental COVID. So the hospitalizations can look like they're coming up. Then what's happening in the ICU? This is a milder variant. There was data yesterday from the big Kaiser Southern California study that showed even despite having higher immunity, this is a more mild variant, even when you control for vaccination status and prior immunity status. There's just something about Omicron, probably it doesn't affect lung cells very much, that make it milder. So we don't have the ICU stays, the oxygen requirements, the ventilations like we used to.
All right, that is all good news. But as you know, some local hospitals are sounding the alarm about being at capacity and canceling elective surgeries like UCSF, where you are, but others seem okay. So then what is actually going on? Is that just because you have some healthcare workers who need to isolate at home due to testing positive? It's not like it's flooded, the hospital's flooded with severely ill COVID patients?
No, it's exactly what you first said. So for example, I'm covering the hospital right now because people to be out. They are quarantining, they're isolating. It's why the CDC right before this tried to shorten the isolation protocols and not require a test, but California DPH requires a test. And then they also said essentially you can go to work if you've been exposed with a mask because they knew this was coming. We are always busier in the winter. We always have people out because they have other respiratory pathogens. And this year, so many people are getting Omicron or exposed to Omicron, it's reducing our staffing. That's what's going on.
Got it. All right, so given that, are you comfortable with healthcare workers who test positive being able to come back to work right away if they don't have any symptoms?
So I think there's 3 ways to think of it. One is if you have symptoms, no, absolutely not, right? Like, so you said, if you have symptoms, you have to wait 5 days. Why? Because the largest contact tracing study that's ever been performed in Taiwan, it was published in JAMA, shows us that the transmission occurs within first 5 days. There was no transmission after 6 days. That's why the CDC said you don't need a test. But the California DPH is required to test. So that is making us have the 10 days of isolation in the state. Then if you are asymptomatic, no symptoms, and you've been exposed, that's called quarantine. Yes, I think it's perfectly fine to wear a mask and go to work. It's what we're doing in schools. It's what my kids are doing in their schools. If they've been exposed, they wear a mask and they go to school. So I would be comfortable with that. We're also strengthening our masks at work. But again, the California DPH is not doing some of the CDC protocols.
All right, Dr. Gandhi, because of the fact that Omicron is leading to generally better outcomes and causing less severe illness in many people, especially the vaccinated. Let's point that out. That's very important, right? Different outcomes
very
for vax and unvax. Some people are now saying they want to deliberately catch it, figuring that, now's the time and they can develop a natural immunity. Is that a good idea or a bad idea? Thoughts?
Well, I never thought no one should ever go deliberately get any infectious disease, actually. Flu, RSV, parainfluenza, you never want to get sick. However, so I wouldn't go have COVID parties, no. The difference is, without doing very much, why? Because it's sort of everywhere. Everyone knows many, many people have it. Mm-hmm. That will be immunity. It raises broad neutralizing antibodies and T cells to all the other variants, especially Delta, which is the one that we hate. So if you get it, then you've boosted your immunity, but I would never deliberately get any infection.
Okay. But at this point, is your thinking everyone's going to get it, or do you think it's still everyone will be exposed, but I can avoid getting infected?
So I think that unless you really are in your house and really can't and can afford to not do anything, and you also wear strong masks when you go outside, it's very hard not to get it. It's just, it's multiple places. The EMA has estimated that half of Europe has COVID. The difference is that if you're vaccinated, it's so much more mild, and you can get exposed but still not get any symptoms at all. Mm-hmm. So I'm sorry to say that it is everywhere. It's a very transmissible variant. And yes, I think that all of us are going to need it unless we're very hunkered down.
All right. I want to bring in some viewer questions. Martha has one about the booster. She says, I am pregnant and my doctor wants me to get a booster shot. Is it safe?
It is safe, though. The pregnancy, we have seen some menstrual irregularities with the vaccine in the first trimester. So boosters should probably be given after the first trimester, just because of the menstrual irregularities that are real and happen with the vaccine.
All right.
But it is a good idea to get boosted in pregnancy because it is an immunosuppressed state. So you don't want to get COVID during pregnancy.
Absolutely. All right. Dr. Gandhi, here's one from Simone. She wants to know, how is Omicron affecting the very young? We're talking about kids under 2 in childcare who cannot wear masks.
So we have been just really lucky with coronavirus that it doesn't affect the young, even those under 2, as much as, older people. It actually has to do with 2 reasons. They don't have the receptors to bring in the virus. And also they have differences in what's called their innate immunity, so it doesn't slip down into the lungs. So it can give young children, the mild symptoms that we're more familiar with COVID in the very young, but it doesn't seem to be hospitalizing them at higher rates. There are children in the hospital with COVID, for sure. But again, there's this incidental aspect that we have to do it. We swab everyone in the hospital for COVID because we want to make sure they're in their own room. We isolate them, but they may not be there for that reason. And data from the University of Massachusetts, at least, and CHOP in Pennsylvania showed us that most of the children being hospitalized are not for COVID, but with COVID.
Got it. Okay, what you call incidental COVID, right?
Right, in their nose.
I want to turn to masking because the CDC, this is a little confusing, right? They're about to update their mask guidance, but the CDC director, Dr. Rochelle Walensky, also said they're not going to tell people what to wear. So I'm not sure if this is a recommendation, but, how should we approach it? I mean, what would you recommend? What do you hope they will recommend?
Okay, so this is what's going on. It's so transmissible of a variant that a lot of people are going to be exposed, like we just talked about. If you want no exposure, if you want to be in that store and really be wearing the best mask possible, then frankly, you have to wear the right mask. And they're going to tell us what those right masks are. And there's one of five. It's N95, KN95, KF94, FFP2s, double mask with cloth and surgical on the outside, or finally, cloth with the little filter paper inside of it. Those are the best masks to wear. There's 6 of them. And that's the one that you really can prevent yourself from getting it. And it works one way. So even if someone next to you is not masking, you are protecting yourself. However, to tell everyone to wear N95 masks or one of these masks when this is such a transmissible variant and people are at different risk levels doesn't make sense at this phase of the pandemic. So it's going to be a recommendation, but not a mandate. And the difference is, for example, little kids, it's very uncomfortable for them to wear N95s or KN95s, and they're least at risk. So something as simple as a surgical mask tucked in is fine for kids.
All right. Do you think it's the federal government's responsibility to make those better masks available free and accessible to all?
The problem is we probably should have done it earlier in the pandemic. However, at this point, if Bernie Sanders said, I'm going to send an N95 to everyone in the country, literally, if you take off an N95, it doesn't fit as well than after you've doffed it. It's called, we actually get fitted for N95s, and it just loosens it by taking it off or on. So you can't really send an N95 mask to someone every day. And that's why there was so much work during this pandemic of more comfortable options that work just as well. Double mask or those cloth with filter work just as well as N95s. We did a paper on this. Much more comfortable.
All right, we want to talk a lot more about testing in schools and other things after a short break. Dr. Monica Gandhi will be answering your questions over on Facebook Live right now.
In commercial break.
Dr. Gandhi, Darlene wants to know, actually her comment is, I tested positive in March with no symptoms, but they occurred on the 10th day of isolation with a vengeance. Is that unusual? And if that is true, then what does that mean in terms of our current, 5-day isolation policy?
That is very unusual, and I'm almost wondering if you got something else 10 days later, because I think we do have to remember there's RSV, parainfluenza, influenza. There's a bunch of different viruses out there, and everyone thinks it's just all COVID. You should get symptoms when you test positive. It's very unusual what you just described.
Okay. Jasmine says, how can we know if we have a real N95? I heard there are many fakes ones being sold. This is true. We reported on that. How can you tell?
Yeah, the problem is the way you can tell is actually you should not be able to smell anything. That's how we test it in the hospital. So you can look on Amazon. They should have very high quality ones. And then you should do a smell test. So like have someone spray perfume and then make sure you can't smell it through your N95. That's how you can tell. That's called NIOSH testing.
All right, Mute has a question. How can you tell if a baby has COVID from a cold?
You can't. Again, the early often get more cold-like symptoms. So you'd have to get them tested.
Okay. And you can test a baby, right? Like you can just take the antigen, that test that you would do, and just use it on the baby? Okay.
You can. It's a little uncomfortable. So
right. The tiny little nostrils, and Lindsay have tiny little swabs.
Be very careful.
Right. Okay. By the way, Randy says Dr. Gandhi is great, and Erica says, yay, love it when Dr. Monica is here. Thank you for all that you do.
Thank you.
I figure you should hear that because you probably hear a lot of other things too. So.
Oh, it's always back and forth. If you're reasonable, you get killed both sides. It's okay.
I know. This is true. Hey, by the way, clarify please, is it cloth over surgical or surgical over cloth?
It's surgical over cloth for a very specific reason. This material, polypropylene.
Oh, hey, let's save that. Let's come back.
I can say it on the air.
Yeah, because I think I've heard the other way too. So.
Yeah, but I'll tell you why.
All right, we are back with UCSF infectious disease specialist, Dr. Monica Gandhi. Dr. Gandhi, a really important question for you. Is it wearing your cloth mask over surgical that's better, or is it more protective to do surgical over cloth? Because I saw a Santa Clara County tweet saying, do the surgical first and cloth over it, but others are pointing out, no, it's the other way around. So it's very confusing.
Yeah, it is actually the other way around, surgical on the outside. Why? Because this is made out of polypropylene material, which is negatively charged. This literally physically repels the virus, and the virus is negatively charged. That's why surgical masks work so much better than cloth. So the double mask is to make it tight against the face, and this is to repel the virus. But you don't want the cloth on the outside.
Okay. Thank you for clarifying that. I want to get into testing. As you heard today, that the Biden administration is sending another 10 million test kits to schools each month. Is that enough, you think?
You know, it's not enough. I think, okay, number one, we didn't know that Omicron was going to be so transmissible. It would have been amazing to have multiple test kits for schools, because I don't think anyone at this point in the pandemic doesn't think that schools shouldn't be open, or at least most people do, because it's been so hard for kids, mental health wise and otherwise, to be out of school. So if we had huge amounts of tests, it would have helped our public schools stay open. And it is, by the time they even get there, the surge is going to be coming down. So that's a criticism that's fair of the Biden government. We didn't have enough tests.
Yeah, we certainly could use more. I wonder, okay, right now, some people are getting PCRs. I know the appointments can be long, the wait for results can be long, and that is the real issue. A doctor friend who was exposed waited 5 days for his PCR results. Should people even seek them out if it takes 5 days?
It really is not useful if it takes 5 days. And beyond that, it can actually just pick up a very tiny amount of virus. It's PCR means it amplifies it up. That's just the definition of PCR. So it could be dead virus in your nose that you pass someone on the street. It's not clinically meaningful without something called a cyclothreshold value. So rapid antigen tests are better. And then, like you said, we have a limitation of rapid antigen tests unless you're a Google employee.
All right, yeah. But a lot of universities are using PCR tests weekly to see if kids can, go to class. Do you think they should switch?
I think they should switch, because PCR tests can stay positive for 90 to 120 days. It's actually why the CDC director really came out and explained why not to use PCR. And so someone can be positive for 90 days and they're absolutely not infectious. So I think people are only realizing the limitations of our tests now.
All right. 2 years in.
Sorry,
okay.
2 years in.
Right.
Sorry.
With those home tests, the antigen ones, should we swab only the nose as the kit suggests, or also the throat, right? I've heard of some doing that, but then others say, no, that could be dangerous.
Well, it's a great question. There's some groups that are saying swab both for Omicron, but you need both. Now, there was a study by UCSF and my colleagues actually that showed that the rapid antigen picks up Omicron just fine with just the nasal swab. And then they're going to do another study to make it better to also swab the throat. So we'll tell you those results and maybe, but they are saying so far just the nose.
Okay. Look, as you probably heard, Sonoma County has issued a shelter-in-place suggestion, if you will, saying if you don't need to go out, try to stay home. And they banned larger events, 100 people for outdoors, 50 for indoors. Do you think at this point that is something that's going to be impactful?
No, it doesn't make sense at this point in the pandemic. Why did we impose lockdowns? At the beginning, because we didn't know how it was spread. Then we figured out how it was spread. And then lockdowns kind of went up and down based on case. Didn't have vaccines. Now we have vaccines. That is the best form of protection to get COVID. There was a CDC study that showed your chance of dying from COVID if you've had 2 doses of vaccines is 0.00003. That's 4 zeros and a 3. That's your chance of dying of COVID if you've had 2 doses of the vaccine. These are amazing vaccines. So I think we've not stressed the effectiveness of the vaccines enough, and we are going to go away from case counts. I know the country is still transitioning, but we need to go away from case counts. Only think about real COVID hospitalizations and deaths as our metrics for restriction gatherings. And no, I don't think it's going to make a difference.
Well, given what we've talked about and, the fact that you're vaccinated and boosted, are you changing any personal habits during this surge?
So I would be fine to do anything during the surge if I wasn't a healthcare worker. So because I am a healthcare worker, I really can't get this because I need to be at work. So because of that, I am changing my habits right now during the surge. But otherwise, if it wasn't a healthcare worker, I think I would be fine because I believe in the vaccines. They're amazing.
Speaking of the vaccine, I want to ask you about Pfizer testing out that hybrid vaccine to also protect against Omicron, to be more Omicron specific. Do you think we'll need it?
See, I don't actually think we'll need it. And by the way, they're going to make a lot of money. But I will say that remember what your B cells do. When you get B cells from the vaccine, If you see the virus in the future, like you just got an Omicron infection, you don't produce antibodies against the Delta variant or the Alpha variant. You produce antibodies against the Omicron variant because your B cells adapt to the very variant they see. They make antibodies adapted to what they see in front of them. That's what's called adaptive immunity. That's how amazing our immune system is. So I don't think we're going to need Omicron specific vaccines. And by the way, Omicron is going to bring down the cases so low. I don't think by the time they get it, we're going to even be worried about it. We're going to be in the endemic stage by the time they get it out. Endemic means low levels.
Oh my goodness. I hope that prediction comes true. Dr. Monica Gandhi.
It's building a wall of immunity. That's what a highly transmissible variant does.
All right. Well, thank you so much. Always appreciate having you on. And I'll just end with Daniel's comment. Let's always have two segments with Dr. Gandhi. She is the best. Smiley face.
Thank you.
All right. Great seeing you. Take care. Coming up next, we'll focus on children. A statewide report card on the well-being of kids in California is out. We'll break it down.
In commercial break.
All right, everybody. Thank you for your comments today. Yes, Dr. Gandhi was fantastic today. Vicki, you're in Sonoma County. Yeah, it's, I'm sorry about that. Thinking of you there in Sonoma County. Van, your question about how do you know what variant you're infected with? You don't know, but I think what public health officials do is they take a sampling. They don't sequence all of them, like all the cases, you know, all the PCR positives, whatever, to see which variant, but they draw a small sample, and from that they kind of extrapolate. I think that's what they do. Daniel, you're right. She is fantastic, and we're lucky to have her here. Some of you are asking, are many states going to be closing? Highly doubtful. I don't think we're seeing that, right? We're seeing temporary adjustments by counties, individual counties. What are the Delta levels now? Very low. Omicron is now at about 98%, over 98%. Welcome back. With distance learning making a comeback temporarily in some Bay Area school districts, a new report card is out showing how kids are doing in California on various aspects affecting their lives. Joining us now, Kelly Hardy, the Senior Managing Director for Health and Research at Children Now and the project lead for the California Children's Report Card just issued today. Kelly, thanks so much for joining us.
Thank you, Kristen.
I should mention to our viewers that Children Now is an Oakland-based research and advocacy organization for children. The summary of your annual report concludes California's kids are facing a grim outlook. How so?
Well, the report card that we released today really shows that California's kids are not okay, and the data here does not lie. We see pandemic-related impacts in many areas of kids' lives, and you mentioned some of them. I know that all the parents out there, including me, are really feeling that kids are having struggles in education, mental health, preventive health care. So there's really a lot of pandemic-related impacts.
All right. Can you tell us how you graded each of these areas? What were your metrics?
Sure. So for each of the 32 areas that we looked at, we graded the state on their ability to support kids, looking at 3 different areas. 1, how are kids actually doing? What are the outcomes there? What's the data? 2, has there been any policy progress? Has the state passed policies that are going to invest more for that issue area for kids? And 3, how is California doing compared to the rest of the country? Are we really near the bottom like we are in many areas, or near the top?
Okay. Like you said, you looked at many areas. One area was average annual earnings in California, because that, of course, affecting the parents and the family, so therefore the kids. Talk about that one.
Sure. So when we see annual earnings, they're really not keeping up with, for families, not keeping up with needs such as childcare. Anyone who has paid for childcare recently really knows that, and with what's expected as far as their payments for healthcare and other expenses related to their kids. And so this is a place where we're really seeing problems. On earnings for childcare workers specifically, these are poverty wages. We need to pay our childcare workers more, taking care of our babies.
Right. Of course. What about education? I know within that there are many different areas like special ed, English language learners. Give us the quick grades for those.
Sure. Really across the board, what we're seeing is some improvement related to recent one-time investments in the K-12 system, the TK through 12 system. And yet we're still lagging behind in many areas. So it kind of remains to be seen whether those one-time investments will make a difference. And of course, we're pushing at Children Now for ongoing investments. It's hard to hire more teachers or invest in sustainable programs if you don't have ongoing money to rely on.
Right.
So that's really
this next year looks good for education investments, but after that, who knows? What about mental health?
Right. On mental health, unfortunately, this is a really, you said the word grim, it's a really tough circumstance. And again, parents out there are unsurprised, but students rating their mental health highly, 68% pre-pandemic, now it's at 39%. These are California students.
What about healthcare?
On healthcare, what we're really seeing is that while there's good investments and intentions at the state level to ensure that kids get health coverage, and they are insured, that we need more accountability to make sure that preventive care is delivered to those kids. Right now, only 26% of babies are getting a well baby checkup. That's not good enough.
Ultimately, we have about 10, well, I guess we should continue this conversation on Facebook Live. Thank you so much, Kelly. Don't go away.
You.
I want to ask you, what is the takeaway then? What do we need to do? So join us on Facebook Live.
In commercial break.
So why do this study? Why is it important to kind of measure all these factors?
Well, we've been putting out this California Children's Report Card since 1990, and we find that it really gives us a good look at where kids are at and where we are pushing the state to invest more or to be doing more on behalf of kids, that they need more supports. And so I think we're doing the study because of that we need that record over time as to what's happening with our kids.
What types of support do you think are absolutely critical right now, especially given the pandemic?
Right. It's really basic things. I mentioned that there's not enough preventive services for kids. And we're talking here about things like blood lead screenings. This is not fancy healthcare. Kids aren't going out and getting, special elective healthcare. This is really, are they being poisoned by blood lead? So very basic services to make sure they're well, they're able to be in school and learning, and the adults around them have the supports that they need to give something to kids. Often we're seeing, especially during the pandemic, that the adults are so strapped, they've got nothing left over for the kids in their lives.
Was there a noticeable difference in terms of how they performed on those measures this year versus in previous years before the pandemic? That is, I guess I'm trying to gauge how devastating of an impact did the pandemic have?
Right. I don't think the impact of the pandemic can be overstated. It's really been a huge a huge crushing blow, but those problems were already there to begin with.
All right, Kelly Hardy, Senior Managing Director for Health and Research at Children Now. Thank you so very much for that insight today. Appreciate it. Thank you for joining us today on this interactive show, Getting Answers. We spent most of the show with infectious disease specialist, Dr. Monica Gandhi, and she answered your questions and covered the big COVID headlines today, including the changing mask guidance coming from the CDC. We also looked at an annual report card on the well-being of California kids, and the kids don't seem to be okay. We'll be here every weekday at 3 on air and on live stream answering your questions. Bye-bye.